Okay, if you're coming in with knee pain, the first thing that we will do is definitely sit down and take a comprehensive history. This will essentially just be having a little chat about what's going on with the knee so we can get a better kind of full understanding of what's going on. We want to really figure out if this is a kind of acute, maybe unstable type of knee pain or a chronic long-standing pain that's maybe more due to just overuse or improper muscular balance. Regardless of which one of those it is, we will definitely go through an orthopedic exam, orthopedic screen, to check in on the structural integrity of those muscles, tendons, ligaments, meniscus in and around the knee. That exam often looks a lot like, giving a little bit of stress to the knee in certain directions, kind of like so. Ultimately trying to see if we can elicit any sort of instability or pain in the knee joint itself. And if we don't get any positive results here, what we will then do, go ahead and push up here, is move into a functional knee evaluation. Pull down. Good. So again, checking structural integrity of some of the major stabilizing ligaments, MCL, LCL, ACL, PCL, meniscus, and a little bit of muscle testing. Kind of cross our T's and dot our I's, make sure we're not missing anything major. Again, after this, we will move into more of a functional knee evaluation that will be on the rehab floor, involving something more like squatting, bending, lunging, and balancing. Hey everyone, I want to walk you through two of my favorite tests to use here in clinic to evaluate single leg stability and control, especially for those of you that may or may not be experiencing some sort of knee pain. That first test I like to evaluate is what we would call single leg squat test. What I'll have Dr. Christine do here is kind of start feet together and then lifting one foot up, go into kind of a single leg squat. We'll typically do about 5 or 6 reps on each side, slow and controlled, and see if we can kind of notice any differences side to side that you may or may not feel. Now, these are what we would consider a good-looking single-leg squat. The most common faults we typically see are going to be what we would call a valgus collapse, where you see the knee kind of diving in across the body here. The other big culprit we do see in those that are having some form of knee pain is going to be like a medial arch or ankle collapse, where if you look a little bit closer down here, you see that foot starts to collapse or roll in as well. That is often usually accompanied with that knee dive, kind of going hand in hand with each other. Like I said, there's other things to look at, but those are typically two of the biggest faults we see in those with knee pain. Now, the second test I like to utilize in clinic here is what we would call either a heel drop test or a touchdown test. So standing on an elevated surface about 12 inches or so, the goal is going to be to drop down and touch the offside heel to the ground, slow and controlled. Again, 5 or 6 reps on each side. You may notice that one side's easier than the other. Just like with the single leg squat test, the biggest kind of error we see in clinic, especially with those with knee pain, is going to be that dive of the knee coming across the body. So again, kind of testing just the same motion, just a little bit different form. Yep, yeah, perfect. So you're seeing the dive here. What you were seeing earlier on, go ahead, can you give one more good one? Perfect. And this would be what we consider a good looking form. I would say the last thing I'll add is another big fault we do see is what we call hip dip or hip drop, which would be here, where you see that hip on this side starts to rock downward in an attempt to cheat and get the foot to the floor sooner. Go ahead, give both of these a try, and as always, if you have any questions, feel free to reach out. So if we've gotten through the history in the orthopedic exam, and we've for the most part ruled out any major instabilities or tears or meniscus lesions, and we have kind of narrowed it down to a more biomechanical deficiency related knee pain or just an overuse injury, here's 2 of my favorite exercises to start with. The first one being Rnt Single Leg Balance. We'll want to band just above the knees, feet together, toes facing straight ahead, slight bend in the knees, and a soft kind of hinge at the hips. We will then take 1 foot away and hold for 30 seconds. The big goal here is to not let this knee dive in across the body. I want to exaggerate the outward fight against that banded resistance, keeping knee over midline of the foot, or even maybe erring towards the outer half. Common faults would be letting that knee dive in or letting this hip kind of poke out to the side. We will then do 30 seconds on each side and go through 3 times. My second favorite exercise to mix in here is going to very closely mimic one of the initial tests that we did in the functional evaluation, the heel touchdown test. And the exercise we call heel drops. So again, elevated surface, the off leg nice and straight. The goal is to reach down and touch a heel to the ground, slow and controlled. No body weight actually shifts over to this leg on this side. Weight is 100% on the elevated leg. Again, nice soft touch. We want knee tracking in a good line, kind of direction of the toes, and hips staying as level as possible. Faults would be letting this knee over here dive across the body or letting those hips get relatively uneven, like so. We go for 15 to 20 touches on each side 3 times through. Give both of these a try for a few weeks and see how it helps your knee pain. Again, if you have any questions, please feel free to reach out. If you're having knee pain and this video resonated well with you, maybe it answered a few questions, or you still have some questions you'd like to ask, by all means, head to the link in the description down below to check out our website, where you can schedule a new patient visit, or we will get you set up with examination and treatment on the same day, or even just give us a call if there's any other questions that we can answer for you. Thanks.